Good morning. This is Stacy. We are loving my veteran, and this is walking in my shoes. Had to say good morning. It's a little slow start as usual. I want to thank everybody for joining us, and I really want to give a shout out to so many people who have just made this possible. For those of you who didn't see it yesterday, we got the official letter from the state of Georgia that we are now incorporated in the state of Georgia as a nonprofit. Never dreamed this would happen, never knew we'd get to this point, but we are super, super, super excited. Um, this week we've been talking about the brain and the effects of PTSD physically on the brain. Um, can't do that without talking about the medications that are prescribed for this. Good morning, Shauna. We can't talk about this without the medications that are prescribed for this and the side effects. I know that this is going to be a tough topic, and I'm not getting into pros and cons of what is and isn't, and I am only using official information. Good morning. Official information that is coming from the VA, and I will post the links to the VA site where you can read more of it for yourself. First of all, when we talk about medications, every medication has a side effect. So that is up to the patient and their physician to discuss the potential treatment and any side effects that it may have. And it is their decision to weigh out the good and the bad. Um, I know for me, I take medication for what I have going on, and it has some crappy side effects, but my doctor and I felt like it was the best choice. So everybody has to make that choice, but I think you have to make an educated choice. And that's kind of where we're going to talk about today. And I have a lot of notes because I want to quote the actual source here. So you're going to see me look down some. And the treatments we're going to talk about today are specifically the drug therapies that are used in treating PTSD. According to the VA website, there are 4 antidepressants that they are using to treat PTSD. And they are SSIRs, which are selective serotonin reuptake inhibitors. And what that does is in the brain, it slows down that process, the reuptake. How do they get that medicine? But the how does it the brain soak it back in? And so these are inhibitors that kind of slow that down. So what they're trying to do is slow down the signal that is given out that you need to feel this way. And then there's serotonin, norepinephrine reuptake inhibitors. So depending on the way that it works. So the medications and the side effects. I want everybody to remember for a minute the symptoms of PTSD. What are you dealing with? What is your veteran dealing with? Inability to sleep, irritability, nightmares, anxiety, depression, um, anger, stress. We have the sleeplessness going on. A lot of partners are talking about the inability to have sex and perform sex, and do that well. So when we're talking about these side effects, um, Zoloft happens to be one of the number one prescribed medications. This normal side effects are with all medications. They can cause nausea, vomiting, dry mouth, the normal stuff. They also cause sexual dysfunction. Zoloft does particularly. It causes night sweats, sleeplessness, insomnia, restlessness, and there is a black box warning on the medication. When you pull out the little piece that you're supposed to read that comes with it, suicidal thoughts. So we are prescribing medication, in this case, to help alleviate the suicidal thoughts, and suicidal thoughts are one of the side effects of this medication. Paxil is another one. We a lot of times our veterans get Paxil. These are the name brands, so I'm just kind of giving that out to you. They cause dizziness, sexual dysfunction, lack of concentration, um, agitation, confusion, abnormal dreams, visual disturbances, anxiety, suicidal thoughts, and loss of interest in things that cause pleasure. That is literally the side effects of that one. Prozac is another one. We give Prozac a lot of times are used, and these are the four that are listed on the VA's website as treatment for PTSD. Prozac causes restlessness, anxiety, aggression, confusion, difficulty concentrating, mood behavior changes, depression, if I didn't already mention that, hostility, nightmares, severe sleeplessness, abnormal dreams, and suicidal thoughts. It also causes that manic state and thinking irrationally or abnormally. So when I started looking at this, I'm thinking, aren't these the things we're trying to fix? And these are the things that it causes. Effexor is another one. Effexor causes nervousness, trouble sleeping, increased blood pressure, sexual dysfunction, agitation and hostility, anxiety, strange dreams, nervousness, and suicidal thoughts. These are the four that the VA is actively prescribing for the use to treat PTSD. There's also other things that they use, and we'll talk about those more tomorrow. Those are like cognitive behavior therapies, and that's going to be like your prolonged exposure, cognitive processing therapy, your eye movement, desensitization and reprocessing, kind of like redoing it. So these are the things that we are prescribing our veterans. And I'm going to see if I can get to this exact site, because this just kind of totally blew me away when I was here looking at this earlier. One of the drugs that we use, that they use, is called nefazodone. It was under the name brand Cerazone. It is an effective medication. Unfortunately, because of the toxic, and I'm reading this word for word, because of liver toxicity, it has only received a weak recommendation for treatment of PTSD. It goes on to say that it affects serotonin by blocking the receptors. It is only available in the generic form. The brand name was removed from the market because of the black box warning regarding liver failure, 1 per 250,000 patients. It was the name brand was removed from the market, and it is still being prescribed today to our veterans. I'm literally reading that word for word off of the website. So to me, it was kind of interesting that we look at the different medications that are done. There are true, and please note this I thought was quite interesting. No, and it says note, and I'm reading it word for word off of the site, and I will, like I said, post the link. Only Zoloft and Paxil have been approved for PTSD treatments by the FDA. All other medications prescribed in this guide are being used off label and have empirical support and practice guideline support only. So, of the medications that are being prescribed for PTSD, only 2 are recommended by the FDA. The other ones are being prescribed off label. I thought that was totally blew me away when I started reading it. And I'm not saying that our veterans shouldn't take this stuff. What I'm saying is I think we need to become very aware of the side effects that we get from this. We need to become very aware of those side effects and how those side effects are affecting our veterans. So if we're utilizing a medication, just like for me for a totally different thing, we have to be very aware of the side effects, and some side effects are more emergent than others. So realize that when we're treating this, can y'all hang on for 1 second? Hello. Yes, I am good. How are you? Sorry, y'all. Okay. I am at work, and I will call y'all in just a little bit and fix it. Okay, I will. Thank you. Sorry, y'all. We're in the middle of moving, and I have to do real stuff at the same time. Didn't mean to interrupt you. But this is what we're seeing as this happens here. There is a whole nother thing, and like I said, this goes on and on and on and on. They use different medications, mood stabilizers as well. Um, and it says revised in 2017, the VA DoD suggests against the use um, of certain medications, mood stabilizers, for the treatment of PTSD. So they are telling you that Lamictal, it suggests against the use of Lamictal, and it suggests against the use of Topamax for treatment of PTSD. Okay. So those are listed on this thing, and I'm not saying that they're not all necessary. What I'm saying is becoming educated as you go forward, so you and your doctor or your veteran's doctor can make an educated decision. I know that so often we watch this happen, that they send out a prescription, and you're like, okay, because we all have faith in our physicians. We're supposed to have faith in our physicians. But when we're not looking at sometimes is the side effects, and is there an alternative, and is there something better, and are you making the best educated guess? So we hear spouses a lot, because the veterans, and God love them, that are going through this at the time, they rely on the spouses, the caregivers, the family members to kind of see where they are. And being when you're in that PTSD moment, not being able to rationalize where you really are makes a big difference here. So I think it's very important. Um, yeah, I mean, and Shauna's making these great comments for me. And Shauna, I will text you. I'm going to post the link so you'll be able to read everything. This whole episode, really, in all its entirety, is dedicated to my dear friend, Jenny Lutz, who lost her son because of being prescribed. And she is is an amazing woman. And when I did this, I said this, I was going to start out by saying that this was for her. She's become the voice and the advocate. And there's a whole movement. If you haven't seen it, Unprescribed is a great movie. It's talking about all these. So I'm reading the comments as we're going. I'm sorry, also I'm like a little ADHD moment here. Um, we use antipsychotics for PTSD, and it again says that it recommends against the use of risperidone in PTSD, and it suggests against the use of other atypical antipsychotics in the treatment of PTSD. These medications were originally developed for patients with psychotic disorders. And there's been an interest in these medications as treatment for many other psychiatric disorders, including PTSD. It would seem reasonable, given their effects on the balance, that it may be used, but it is still recommended against the use of these medicines. So there are this page is full and full of stuff that we're using. Atypical antipsychotics are not recommended as the only therapy for PTSD. Risperidone, which is contraindicated for use as an adjunct agent. Potential harm side effects exceed the benefits. And how many of our veterans are on this? How many of our, and this is not something that I researched and is my opinion. This is literally on the VA website. I had to search it to find it on the VA website. So it's kind of like their disclaimer, but it's there. There is another whole thing about as we go forward that we're talking about things like we give benzos. There's so much talk about using benzodiazepines in PTSD. Your benzodiazepines are your Ativans, your Klonopins, your Xanax, your Valium. One, it is very addictive, and it says right here, this is the only potentially addictive group of medications discussed. Limited studies have not shown them to be useful in treating the core PTSD symptoms. There are several other concerns about the use of benzodiazepines, including disinhibitions, difficulty integrating the traumatic experience, interfering with the mental processes needed to benefit from the psychotherapy, increased falls and mental clouding, addiction, an increase in overall mortality in a recent study combining PE and Xanax. The group that had both, the group that received Xanax had, and I am quoting, a poorer outcome in PTSD symptom reduction than the group getting PE treatment alone. Scary. How many of our veterans are getting these medications? And I am literally reading directly off of the VA's website. I am literally reading it word for word off of the VA website. Okay, again, this is also off of the VA website. I about had a heart attack when I read this, and there is a video that will also be posted. Dr. Laura Gibbons describes how benzodiazepines get in the way of PTSD treatment. Okay? Benzodiazepines, and I'm quoting this, are medications given by a doctor to improve anxiety and sleep. They do not help with PTSD symptoms and can have serious side effects over time. There are better treatment options. I'm reading it word for word. What are the problems that arise? They provide short-term relief from distressing feelings, but can become a problem in the long run. You can become dependent on the medication and end up feeling like you cannot face stressful situations without it. If you use benzodiazepines to escape reminders of your trauma, you'll never truly learn to manage your stress. This makes it harder to recover from PTSD, and effective treatments for PTSD like talk therapy help you stop avoiding distressing situations and memories. The VA website. Education. Education. We have to become, as advocates, educated. We have to, as their loved ones, become educated. Does it work on some patients? Absolutely. I am never saying take my advice over the advice of your physician. But what I am saying is ask the questions. I can tell you from experience, flat out experience, that we do nothing on my medication that Carl and I have not researched, talked about, gotten the absolute best recommendation from my doctor. We've weighed out the side effects, the pros and the cons, and I have two doctors that I use. My specialist and my primary care, who I trust with my life. I've known him for 20 years. I never take anything without consulting. And we look for side effects and we pay attention to side effects. PTSD is horrible. The depression created by the PTSD is horrible. We are losing 22 plus veterans a day to suicide. What we don't know the answer to, what we are not getting the numbers for, what we are going to dig further into is how many of the 22 a day were on treatment for PTSD and still committed suicide. Just a question. Just food for thought. When we love our veterans, we have to become their advocate. We have to become their voice. We have to become the person who leaves no stone unturned. Because remember what we talked about earlier this week, their brain doesn't function the same way. They're always in that fight or flight. We have veterans who are afraid of treatment. We have veterans who are scared of treatment. We have veterans that don't trust the treatments out there. When I read this last night, when I really sat down and read this last night, I already had the list of medications and the side effects because that's what I do. But when I read this last night that said the medication we are giving our veterans has been pulled from the market to the general population because it's good enough for our veterans. When I listen to, and I ask this question on multiple groups, what is your spouse taking? What is your veteran taking? And I'm looking at the prescribed PTSD medicines, which they do take, but then I also see that we're giving them benzos on top of it. Johnny Lutz, prime example, my dear friend who has taken such a tragedy and turned it around to something positive. Her son was given medication for PTSD, which we already know increases side effects. Her son was given benzodiazepines. And then for back pain on the same treatment with a different doctor, he was given opioids on top of that. He committed suicide. He was literally given the gun in he had already given his mom because he was afraid of where he was going to be. But he goes to get help. He was given the gun in the form of pills. We gave that to him. The people who were supposed to help gave that to him. He was there by himself at the VA. It isn't like they called a family member or caregiver or support somebody or somebody who said, we're prescribing him this. These are the side effects. Please watch for them. In my case, my physician won't prescribe anything for me that Carl is not sitting there to listen to the side effects because the side effects can be dangerous. And we prescribe, or our veterans are prescribed these medications with no plan. If you want to commit suicide, it is disappointing and it's sad. If you want to commit suicide and you're on a 72-hour crisis hold, you can't be discharged without a care plan in place that is signed by you and somebody who's going to be responsible for your care plan. And now we are giving medications to people with horrific side effects. The potential for, do they affect everybody? No. Are they successful in a lot of patients? Absolutely. But we are giving these medications without a care plan and somebody to watch the side effects. I'm not giving my views and preaching this. I'm just telling you from a medical standpoint, this is insane. This, from a human standpoint, is insane. Johnny Lutz is one of who went to get help and in reality was given it in the his mom had no idea of the combination of the drugs he was given and potential side effects of the medication until it was too late, because he was a grown man who had gone overseas and fought for his country and they trusted in the system, and she didn't know until it was too late. Prescriptions. How many times are we using? You know, again, it is a conversation to have with your caregiver, your physician. Know the positive and the negatives before you ever do it. Look at what drugs are mixing and interacting. How do they work? What is the interaction? You know, where does that go? And I'm not just talking about normal interaction. I'm talking about potential interactions, even on the CBD kind and the recreational side. My mother is in intense pain after having breast cancer and going through those treatments. Okay. So and she has arthritis and she's on that 5-year long-term pill. Well, her pharmacist recommended CBD oil, which was great. She took it and she was amazing. The problem is that the CBD oil that she was taking at the recommendation of her pharmacist was counteracting the 5-year chemotherapy. So you have to be aware of everything and how they all come together. You have to make it known. You have to figure it out. You have to do all the pieces. You have to do the research. And as your veterans advocate, you got to be on top of it. You got to speak up. You got to make your concerns known. Because what's going to happen is you are going to be the one who's going to be able to say, this isn't right. And your veteran in return is going to find decent treatment that works for him. And remember what I said earlier, we talked about it 100 times, distrust, feeling alone, feeling abandoned. How do you think your veteran's going to feel when you read the side effects and you read the stuff and you go in and you say to them, you're not doing this to him. Explain to me why this is better. He is my most important goal. Think about it from that perspective. So yeah, I know this was a little deep. And again, I'm not bashing any treatment. Give me just a few minutes and I will get all the links up and the videos up. I'll put them in the comments to here. I think it is critically important that we become aware. And again, I'm not the side effects I actually got from the manufacturer's site of their side effects, but the treatments and what we can and cannot use and what is and is not recommended is literally on the VA website. And like I said, I was quoting it word for word, so I'm sorry if I look down a lot. I just was passionate about this and how this works. So that's kind of where we are in this. Tomorrow we're going to talk about some of the other non-drug treatments and how they're working and some of the new experimental stuff which is out there, just so you kind of have a broader view, because I don't think we can talk about one without talking about the other. Um, just wanted to throw that out. Don't forget tonight we have our Zoom meeting. Let's talk. This may be a great topic to start discussing. It is at 7 p.m. Eastern Time. The link is on the um, websites and the Facebook pages. If you need it sent to you directly, just send us a message and I'll be happy to do that. Things are just going somewhere and we're so excited. Again, big stuff coming in the summer 2021. We should hopefully be able, we're going to have a meeting early next week where we should be able to release more of the upcoming details 2021. So get ready for that. Um, if you want pure entertainment and you want to see some great interacting and some way that some of the veterans feel, go check out this week's Behind the Service podcast. There are, what was this, episode 19 that was released? There are tons of other ones that are so informative on there, and so much good stuff coming forward. So I just want all y'all to be aware of that. Um, and we, as Loving My Veteran, cannot thank you enough for your support and for you joining this community so we can become stronger together. Where we are going and growing is just absolutely amazing. I'm Stacy. This has been Walking in My Shoes, and we are Loving My Veteran, where, you know, you guys really do matter to us.